Pyometra. Pyometra is a medical condition that occurs in female mammals, including dogs and cats, where there is a buildup of pus in the uterus. This is a potentially life-threatening condition that requires prompt veterinary attention. Pyometra is usually seen in older female dogs and cats who have not been spayed. It occurs when the lining of the uterus becomes thick and inflamed, allowing bacteria to enter and infect the uterus. The bacteria then cause an accumulation of pus within the uterus, which can lead to sepsis, a dangerous systemic infection. Symptoms of pyometra in dogs and cats include lethargy, loss of appetite, vomiting, diarrhea, excessive thirst, and frequent urination. Some animals may also have a fever, and their abdomens may become distended or painful to the touch. Treatment for pyometra usually involves emergency surgery to remove the infected uterus, along with supportive care such as antibiotics and IV fluids. Prevention of pyometra is best achieved through spaying female dogs and cats before they develop the condition. Causes of pyometra. Pyometra is caused by a bacterial infection of the uterus in female mammals. In dogs and cats, it typically occurs in animals that have not been spayed, although it can occur in spayed animals as well. The lining of the uterus in female animals changes in response to hormones during the reproductive cycle. If an animal is not pregnant or if the pregnancy is terminated early, the lining of the uterus may not be fully shed. This can create an environment that is conducive to bacterial growth. When bacteria enter the uterus, they can cause an infection that leads to inflammation and thickening of the uterine lining. This can create an ideal environment for more bacteria to grow, leading to the accumulation of pus within the uterus. The exact bacteria that cause pyometra can vary, but the most common bacteria involved are Escherichia coli, E. coli, and Staphylococcus spp. Other bacteria such as Streptococcus, Proteus, and Klebsiella can also be involved. Factors that can increase the risk of pyometra include age, hormonal imbalances, obesity, and a history of previous reproductive tract infections. How dangerous is pyometra? Pyometra is a potentially life-threatening condition in dogs and cats. Without prompt and appropriate treatment, it can lead to sepsis, a systemic bacterial infection that can cause organ failure and even death. The accumulation of pus within the uterus can also cause the uterus to rupture, leading to severe abdominal pain, shock, and death. In addition to the immediate dangers, pyometra can also cause long-term health problems if it is not treated promptly. These can include kidney failure, liver disease, and other systemic illnesses. Fortunately, most cases of pyometra can be successfully treated with a combination of surgery to remove the infected uterus and antibiotics to treat the bacterial infection. However, the success of treatment depends on how quickly the condition is diagnosed and treated. Therefore, it is important to seek veterinary care promptly if you suspect your dog or cat may have pyometra. Pyometra remedy. The primary treatment for pyometra in dogs and cats is surgical removal of the infected uterus, a procedure known as an ovariohysterectomy or spay. This is an emergency procedure that is usually performed as soon as the diagnosis of pyometra is made. In addition to surgery, supportive care such as antibiotics and intravenous fluids may be needed to help the animal recover from the infection and surgery. Antibiotics are typically used to treat the bacterial infection and prevent the spread of bacteria to other organs in the body. Pain management medication may also be administered to keep the animal comfortable during and after the surgery. After the surgery, the animal will need to be closely monitored for any signs of complications such as bleeding or infection. Prevention is the best remedy for pyometra. The most effective way to prevent pyometra is to spay female dogs and cats before they develop the condition. This not only eliminates the risk of pyometra but also reduces the risk of other reproductive diseases such as mammary gland tumors and ovarian cysts.